with a discharging sinus around the coccyx. So, what is the diagnosis? Let me lead you to the diagnosis. So, what is here called in Latin? What is the focus or center source is called in Latin? Nidus. So, a patient who is hairy, a patient who has to sit for long hours, a patient who is a driver, a patient who is an executive, what will happen to that hairy part? The end of hair, because of constant shear and friction forces, the sharp end of hair will erode the skin, and gradually the hair will start growing within that eroded, ulcerated part. And, hair will grow inside that raw area and will be plucked from the hair follicle and will be entrapped in that ulcer. Healing will occur, and that excoriated area will heal. Hair or trapped inside will happen. What will that foreign body do? Inflammatory reaction, and then abscess formation, and then discharge analysis. A discharging sinus will appear.
And body has to be removed.
And unless you remove that foreign body, it will keep on healing and discharging at regular intervals. This condition is called pilonidal sinus, and this was noticed commonly in World War II in jeeps drivers, because they had to stay. This condition was noticed among jeep drivers because of constant friction forces. They developed this type of sinus. This condition was noticed in those drivers, and the condition was named as jeep drivers bottom disease. Sinus. What is a sinus and what is a fistula?
Fistula is connection of the
Communication between two
two
epithelial surfaces, and sinus is a blind tract like in pilonidal sinus. So it is a persistent discharging sinus around coccyx region. So this is pilonidal sinus. So history and examination. So you will immediately reach to the conclusion of diagnosis of pilonidal sinus. So how will you treat this patient? This condition has multiple options of surgical treatments. Will always result in recurrence. So that's why multiple treatment options were involved. For example, incisional drainage, as you said. For example, axial. Why is this area prone to develop pilonidal sinus? Because of hairy, number one, and because of natal cleft, that is that furrow, that deep part. So people thought that by pulled skin and subcutaneous tissue of one side towards the other side and stitched it. So flap rotation. This procedure is called Pathogenesis procedure. Obliterating the natal cleft by making the incision line not in the center but on the side. My preferred treatment is Pathogenesis procedure, in which we make an ellipse around the sinus, go deep down to the pre-sacral fascia, remove that chunk, and then undermine the flap and pull it towards one side and stitch it. Okay. And we always place a drain here.